Hi, thank you for asking us to speak today. We're actually very excited to be here to launch our website. First, I thought I'd give some background on sexual and reproductive health in CF and why it's important to talk about it in adolescence, and also why it's so difficult to talk about it in adolescence, both from the perspective of health professionals and from parents. So we expect young people with cystic fibrosis to have the same developmental trajectories as people without cystic fibrosis. And what you can see in this figure is the normal sort of typical education and employment timeline across the top row. And that's what we expect all of our children and adolescents with CF to be doing, give or take, at the same time as their peers without CF. Down on the bottom row, you can see a typical timeline. It's a very typical general timeline of CF and disease progression. And as CF teams, we're very well practiced at dealing with these issues as they arise and implementing treatments and education as need be. What's in the middle is the sexual and reproductive health timeline. And we expect that young people with CF will encounter the same sexual and reproductive health milestones as young people without CF. And that includes puberty in early adolescence and the onset of sexual activity in late adolescence. What we often don't talk about is that the interplay between cystic fibrosis and sexual and reproductive health, and how that there are a number of sexual and reproductive health topics that have considerations that are very specific to CF, and also how your CF may impact on the development of your sexual and reproductive health identity, given that you're maturing and that your disease is progressing all around the same time. So in terms of the general sexual and reproductive health topics that are important to address, these include pubertal development, the timing of menarche or onset of periods, prevention of sexually transmitted infections, immunisations, and particularly the human papillomavirus vaccination or Gardasil and hepatitis B vaccine, contraception, preventative health including pap smears, and reproductive decision making. And you can see from those asterisks that both contraception and reproductive decision making have considerations that may be specific in people with CF. There are also a number of specific topics relevant to young people and adults with CF. These include urinary incontinence, genital candidiasis or thrush, fertility for both males and females, assessment of fertility status in males, and that involves semen analysis or a test that looks at your sperm count, genetic and pre-pregnancy counselling, access to assisted reproductive technologies such as IVF, and pregnancy itself. There have been some studies looking at how people are educated about CF-related sexual and reproductive health. From work that was done predominantly at the Children's Hospital in Victoria almost 10 years ago now, we know that most parents are educated about male infertility by their CF teams around the time of diagnosis. We also know that parents of both males and females then go on to have very few discussions with their CF teams about sexual and reproductive health as their children grow up. And most of those conversations that do occur because parents ask rather than because the issues are raised through clinics. There have been a number of studies looking at how patients receive their information about sexual and reproductive health, and we know from Australia-wide studies of adult males that men are finding out about infertility, particularly later than they wanted to and in less than ideal ways. We also know from studies of adults and young adults across Australia and Europe that the information that they receive from their CF teams are often inadequate, and that both men and women are seeking information from other sources. And there's been a recent study in the UK looking at how many people are seeking contraceptive advice without discussing those sorts of issues with their CF teams, and the numbers are fairly high. There have also been studies exploring what adults know about CF-related sexual and reproductive health. And what we do know is that there is a lot of confusion and a lot of misunderstanding. Many adult men underestimate the prevalence of infertility, and conversely, many females with CF believe that they can't become pregnant. Adult men, and indeed a number of adolescents, have admitted to confusing infertility and impotence, and in qualitative work this statistic is as high as 40% of adolescents. There's also a misunderstanding of the risk of sexually transmitted infections, and many men have reported that when they were adolescents, they thought that because they were infertile, they didn't need to use barrier protection like condoms. Interestingly, that number is higher amongst those who receive most of their sexual and reproductive health education from their CF doctors rather than from their parents. There are also people who have had difficulty accessing semen analysis, and from Australia-wide studies, the number of men that have accessed semen analysis is between a quarter to a half, whereas most people talk about how they would have liked to have access to that at some stage. There are a number of barriers to addressing sexual and reproductive health with adolescents with CF, and this is work from looking at both parents' opinions and the opinions of CF clinicians. So parents report concerns relating to privacy. They report being concerned about embarrassment, both of themselves and their child, as well as of their doctor. They're concerned about the appropriateness of having these sorts of discussions with their child present. And there are concerns relating to there being not enough time in CF clinic, that there are always more immediate CF issues that demand attention, and that this is a difficult conversation to start. Similarly, CF clinicians report embarrassment, lack of time, that it's difficult to find the right time, that discussing what's seen as bad news is difficult, that there may be insufficient training in sexual and reproductive health, and that there are often more important, particularly more immediate concerns in relation to CF care that need to be addressed. There's also been some research into what would be an ideal way of educating people about sexual and reproductive health and about an ideal way of addressing sexual and reproductive health within CF clinics. Parents of males have told us that they'd like to be informed of male infertility around the time of diagnosis, and then parents of males and females would like further information about sexual and reproductive health during their child's adolescence and, in fact, late childhood, so that they have the information before their children need to hear it from them and before they need to support their children in learning this sort of information. The research in Australia has said that parents would like to hear this information from the CF team and from their CF teams, and we're certainly interested in feedback. Studies of patients have said, and these are mainly studies of adults who are looking back on adolescents, have said that they would like information as they're growing up at various stages as is developmentally appropriate, and that they identify both their parents and their CF teams as appropriate sources of information. What is clear is that this is not a one-off conversation, that these conversations need to be returned and addressed to, probably with more detail depending on what the needs of the person are, and that it needs to be a combination of the CF teams and parents providing this sort of education. So what is SPIL? We at the Royal Children's Hospital and Monash Children's Health, together with Cystic Fibrosis Victoria and the Digital Clinic and Siobhan Burke from the Centre for Excellence in Rural Sexual Health, have been involved in designing a digital educational resource, which by the end of the month will be available as a website and an app for young people with CF. And its purpose is to provide easily accessible, accurate CF-related sexual and reproductive health information for young people in a safe environment. It's intended both to raise awareness and to complement the education that is occurring in the home and in clinic, and to replace some of the older written information in a more up-to-date and sort of user-friendly way, as you'll see from what we'll show you soon. The content has been provided by both CF and sexual health physicians, and there has been extensive collaboration with young people who have been involved in the website design and who, as you will see soon, have been providing quotes, clips and extensive feedback. So I'm going to introduce Nikki Kavanagh from the Digital Clinic, who's going to give you a sneak preview of the website. It will be launched at the CFV Community Conference at the end of the month and ultimately rolled out through Victoria and then we hope throughout the rest of Australia. And before I introduce Nikki, I'd just like to acknowledge everyone who's been involved in this work, and in particular all of the young people who have helped contribute and who have volunteered to help us with this work.
Oh. Hi, I'm Nikki Kavanagh. I'm the producer of this website, and I've had a wonderful time working with these young people, and I am, the parents of these young people, and there's one in the room, should be very proud of the commitment that they've made to this project, and they were extraordinary, and I hope that we've done them justice by producing a resource that they're proud of as well. So, as we said before, it's Spill, and we have a female and a male pathway through the site, and these two young people are 20-year-olds with cystic fibrosis in Victoria, and we have Chris's mum here, and then Shelley, who's, I don't think her mum is at this conference, but they were amazing, and you'll see more from them shortly. So I might start by going down the boys' pathway. Now you have to, I'll just demonstrating on something that's not my computer. This is on a staging site currently, so it may be a little clunky, but it'll give you the right idea. So as I said, or as Catherine said earlier, we consulted with young people around the style, and we got a lot of reference. So they sort of spoke to us about the fact that they wanted a Tumblr type feel to the resource that we created. So they were really, really involved in what we produced. The other thing that we were very mindful of is the fact that we wanted to stagger the content. So we started with the least sensitive information and progressed through to the more sensitive content. And with this, they have the opportunity to click on text boxes or the video. So I'll go through some of those shortly. I'm just going to take you quickly through the sections. You can see it's very youth-friendly in its style. And we've used quotes from young people around, their experiences, and particularly using things like that quote that Catherine mentioned, around 40% of boys confusing infertility with impotence, to just give that sense that it's okay not to know everything, that's kind of the experience of other people that have been through this as well. I'll just take you to, actually, I might show you a clip in fertility. All right, so this is Murray, who very kindly gave us his time to talk about his experiences.
I would say it was like one. We were just, I don't even know how the topic began, but we were talking about, girls and whatever else, and then all of a sudden it got onto the topic of for some reason all our friends and all people that we know, obviously, they're ejaculating, and all of us obviously found out at that point that it was obviously a really awkward conversation for all of us, because we all didn't really want to be the first one to put up a hand and say, well, no we don't, but once one of us said it, I think we all kind of went, oh yeah, no, we all don't.
When the other boys talked about it, did you feel relieved?
I think it was a massive relief, just because then you're not abnormal to the CF side to it, and you're never really gonna know, because everyone's different and everyone has different experiences, and I'm sure people that don't have CF, might have later puberty and all those type of things, but for yourself, you think, well, at least the people I'm talking to right now, they're going through the same thing as me.
So we were very, very lucky to have such fantastic young people, and they were all really excited to be involved, because they were very clear about the fact that it would have been helpful to have heard that sort of stuff earlier for them as well. So I'll just scroll down to, trying not to go too fast, sorry, through it all for you, but there's a lot of text boxes that pop up, so if they're looking for additional information, they can click on the sections that they feel comfortable reading. So we've covered off a lot of those, the content that Catherine mentioned earlier that's very important, STIs. A lot of the work that we've done with this is really in line with user behaviour for young people, so we've spent a lot of time working out how young boys and girls use and seek information online, and we've tried to adhere to that as closely as possible. Now this is one of my favourite clips, because I just love the fact that Chris was so comfortable speaking about this. They've all seen it and are very aware of where the content is going to be used.
During sex, it does get tiring sometimes. I'd be out of breath, and sometimes I'd have coughing fits around the middle. But the girls I've been with, they've known about it, and most of the time we'll just have a laugh about it. And yeah, pretty much just have a timeout, and then you'd get back into it when the coughing fit's over. Maybe get a glass of water. Yeah.
But it's not that big a deal?
No, not really. I'm coughing now, yeah.
So yeah, we were very lucky to get to interview those amazing young people, and I'll just take you through now the girls' pathway, which will go back to the homepage. Yep. So it's very similar. The two pathways are the same throughout, but we just have the content specific to the gender, but they can access both sides if they're interested. So I think this is a really nice section because Shelley speaks so beautifully about her experiences, and she does it in a way that she's speaking to younger people that are approaching those times, and I really, really like her style. I think she did an amazing job. So we'll just play a clip that she spoke about her issues with urinary incontinence, hopefully. No.
So, urinary incontinence has been quite a large issue for me, more so than thrush, but it's just it's been there for so long now, I really can't even remember a time when it hasn't been a problem. Don't think you have to carry all of it yourself. There are people out there that, obviously doctors and part of your CF team, that are going to help. And yeah, just look into it, find whatever way works for you, but never feel ashamed. We all get it, and that's been like one of the big things about the urinary incontinence is it's not just me, it's not just CF, it's all women, which is really nice. Makes it a bit easier to look after and know, you're not, by no means is it just you.
Just quickly, so as I showed you before, it's very similar to the boys section, but we've used quotes that are more relevant to girls. Like, it was actually Shelley that said this quote that she said everyone was coming to school saying, I woke up with these amazing boobs, and she was like still waiting, so she sort of normalises the experience that she had and that other young girls may have. Same kinds of things, so they have the choice of looking at pop-up boxes or video content in each section. Trying to find, actually, sorry, I am going back again. I've lost track of where I was up to. There's a clip of Shelley's, one more clip I'd just like to show you before I finish, and you can ask Catherine as many questions as you like. My pleasure. Was it the one, hang on, sorry. Sorry, I'll just keep going to the next section. It's not linking that one, unfortunately. As I said, lots of young people that were involved in this all were happy to give their time. It was quite a big shoot day, and they were all pretty amazing, actually. Again, same kind of text boxes that come up. Okay, this is the one I was looking for. Is there a reason that this isn't clicking for me? There we go.
I was really lucky in the sense that I've been with Jared since we were 12, and pretty much the time we met was when I started getting sick. So he was with me through everything, like when I got my PEG, when I got my port, when I had like major surgeries. So it wasn't like by the time we got to having sex, it wasn't like, oh, what's that, like he was there through all of it and supportive the whole time. So he was totally, couldn't be more supportive. But yeah, just the like occasional hold on, just need to cough or get my breath back. It's better now, but in the beginning when I was sicker, yeah. If it was someone who wasn't in the position I was in where you were with your partner for a long time, I think still obviously bring it up. It's part of who you are, and if you want to be that intimate with someone, I would assume they would respect you in the sense of being like, hold on, I've got to do this.
I might just finish it there because that's a little bit of a longer clip, but you get a sense of what we've done. So they're speaking from their, that retrospective thing about their experiences with puberty, and importantly, as Jude said, I'm also a mother of teenagers who would prefer to eat broken glass than have these conversations with me. So I hope that this resource helps you engage your young adults in these conversations, and I feel very confident that the young people that use this resource will find it an engaging experience, because we have, like I said, we have really, really worked very hard in consultation with young people to ensure that it's something that they're happy to be using. So, thanks.